All right, and welcome. This is Celebrity Pharmacologist, and today let's look at this simple clinical pharmacology question that is on the board. The question says a 68-year-old man with newly diagnosed hypertension is started on amlodipine 5 milligram once daily. After 4 weeks, his blood pressure remains 152/94 millimeters of mercury, despite good adherence. Which of these following is the most appropriate next step? A. Stop amlodipine and start nifedipine. B. Increase amlodipine to 10 mg or consider adding a second antihypertensive. C. Discontinue treatment because amlodipine has failed. D. Double the dose to 20 milligram daily. First, before we answer this question, if this is your first time of coming across the Celebrity Pharmacologist, please do well to save this video. Save any of my videos, like, share, and share this video to those in medicine, pharmacy, or any medical practice. Now, let's answer this question. Looking at this question is asking for the next step. And what was the first step? The patient is taking 5 milligram of amlodipine once daily. Now, what should be the next step? Option A says stop amlodipine and start nifedipine. Why we should not start nifedipine is because we said that it can drop or drastically drop the blood pressure that can even lead to hypotension. It can even cause what we call reflex tachycardia. So nifedipine is not the best. It's not a daily routine antihypertensive. Now, option B says increase amlodipine to 10 milligram or consider adding a second antihypertensive, which is very, very good. But we don't know if it's the answer yet, but it's very, very good because uh, they started with 5 milligram. So the standard dose for amlodipine is 10 milligram. So increasing from 5 to 10, then considering and adding another class of antihypertensive like the ACE inhibitors or the ARBs. ARBs, you can also do that and it will be very, very helpful. Then C says discontinue treatment because amlodipine has failed. For just 4 weeks, we can't judge or consider amlodipine a failure because it's just 4 weeks. So the appropriate answer here is to do the B. Then D says double the dose to 20 milligram, of course, which is not correct. Doubling the dose to 20 milligram, you are only increasing what we call adverse effects of amlodipine. I want you to tell me some adverse effects you know that amlodipine can actually cause. If you know them, tell me in the comment section. So the correct answer here still remains option B. If you like this kind of video, please do want to follow the Celebrity Mycology. Share this video. Goodbye until next time.